Do you have painful periods where you're unable to do normal activities? Have you ever experienced pain during or after sex? Do you feel bloated in your tummy, constipated, or have diarrhea during your periods? Are you having trouble conceiving? If you answer yes to any of these questions, then you may have endometriosis. Hi, I'm Dr. Chua Shih Keat, the consultant gynaecologist working in Lo Guan Lai Specialist Center. Endometriosis is a condition in which tissue similar to the lining of the womb is present outside of the womb, such as the fallopian tubes, ovaries, bladder, bowels, even as far as the lungs. It can cause severe pain in the pelvis and make it harder to get pregnant. Endometriosis can occur at a person's first menstrual period and last until menopause. Endometriosis leads to chronic inflammation and scar tissue formation in the pelvis and elsewhere in the body. Symptoms of endometriosis depends on the location of the disease. For example, if it's in the uterus, it may cause severe pain during menses and heavy bleeding. And if it's in the bowel, you may experience bloatedness, constipation, sometimes bleeding in the stool. If it's in the bladder, you may experience pain during urination and also blood in the urine. When you come to the clinic, we will usually take a very detailed menstrual history which will help us to make a diagnosis of endometriosis. Then we will examine your tummy to look for any pain or any swellings. The ultrasound is a must to look for any enlarged womb or presence of ovarian cysts. Sometimes we will order an MRI or CT scan, which is helpful to make a diagnosis and also to plan for surgery. However, if the diagnosis is unclear, sometimes we need to do a laparoscopy to get a definitive diagnosis and also a biopsy from your tummy. Up until now, we do not know the exact cause of endometriosis. However, there are risk factors associated with endometriosis. Number 1, family history. If your mother or sister has the condition, it will significantly increase your own risk of developing it. Number 2, early age of menstruation, especially if you start to have menses in less than 11 years old. If you have short menstrual cycle of less than 27 days, that will also increases your chances of endometriosis. Long duration of menstrual flow is also a risk factor. Heavy bleeding during menses and also difficulty conceiving. Endometriosis causes chronic inflammatory reaction that may result in the formation of scar tissue and distorted anatomy of the affected organs. Examples of different appearances of endometriosis in the body are superficial endometriosis, which is found mainly in the lining of the pelvis, ovarian endometriosis, commonly known as chocolate cysts in the ovaries. Deep endometriosis is found in between the bladder, vagina, and bowel. In rare cases, endometriosis has been found outside of the pelvis, such as the lungs, the brain, and the bones. Very often, women present to their doctors very late. They think their menstrual pain is normal discomfort, and therefore they delay seeking medical attention. Some ladies feel embarrassed to discuss this with their doctors. And they also mistake the symptoms for other conditions, such as bowel disease, leading to misdiagnosis and delay in investigation. If you have endometriosis, doctors usually advise the ladies to plan for early pregnancy because endometriosis may affect fertility. Pregnancy may temporarily suppress endometriosis and improve your symptoms, but it will recur when your menses return. Delayed diagnosis can result in more severe symptoms, increase in complications, and potential fertility issues. So, familiarize yourself with these symptoms, understand the pattern, and record them. And seek help early from a healthcare professional. Early diagnosis is key to minimizing the complications of endometriosis. Remember, there are treatment options available and you are not alone. If you find this video helpful, please check out my other video.